Health provides the latest update on COVID-19 in our country. We begin today with our Minister, Minister Wells.
Good afternoon. Here's the latest update on COVID-19 as of Sunday, the 13th of September. The Bahamas has recorded 2,974 confirmed cases of COVID-19. Of that number, 1,344 have recovered. 1,545 cases are active. 72 of those active cases are hospitalized. Unfortunately, 75 people have either died with or from COVID-19. There are 8 deaths under investigation, and presently, New Providence has recorded a total of some 2,113 cases. Following New Providence, Grand Bahama has 597 cases. Abaco, 100 cases. Bimini, 54 cases. Exuma, 24. Inagua, 17. The Berry Islands, 15. Eleuthera, 12. There have been 8 confirmed cases in Cat Island, 8 in Long Island, 7 in Acklands, 5 in Crooked Island, 3 in Andros, 3 in Maguana, and 108 cases, the locations are pending. There has been a total of 15,196 tests completed to date in country. As I communicated in the House of Assembly last Wednesday, the COVID-19 response strategy of increasing bed capacity, repairing healthcare facility, and COVID-19 testing is ongoing. The South Beach Acute Care and Referral Center was not originally designed to admit patients with COVID-19, but can now accommodate 16 beds. This is an increase from 10 beds. The Legacy Unit at Princess Margaret Hospital, PMH, has been expanded from 4 beds to 8 beds. There are 22 beds at Doctors Hospital West, and Doctors Hospital East has made 5 beds available for COVID-19 care. The bed capacity at the Cancer Association of the Bahamas in Grand Bahama has been expanded to 16. 7 beds will soon be available for use in Grand Bahama Health Services System. Social Services is still in the process of relocating the boarders at PMH. The PHA can confirm that 9 boarders have since been discharged from PMH and have been accommodated outside of the hospital. An additional 10 boarders are currently being tested to ensure they are COVID-19 negative and will be discharged once tests are confirmed as such. This process, as indicated previously, will allow for more bed space inside of PMH. In a similar fashion, like the boarders at PMH, some persons are using the morgue at PMH as a storage facility for their deceased loved ones. We understand that death and losing a loved one is an emotional and sensitive time. However, the morgue at the Princess Margaret Hospital continues to be stretched to capacity as a result of the delayed collection of loved ones who have passed. Given the necessary restrictions due to COVID-19 that had to be put in place as it pertains to funerals, some members of the public are opting to wait until restrictions have been lessened to collect the bodies of their loved ones. We are encouraging members of the public to arrange with a mortuary company to secure and retrieve their loved ones. We are also, again, urging the local mortuary companies to collect the bodies that persons have already paid them to transport to their funeral home of choice. The failure of these companies to comply will have to unfortunately result in the existing legal storage fees being applied. My fellow Bahamians, at the Rand Memorial Hospital, Part A of the restoration project is on schedule for completion at the end of September. This includes main entrance, foyer, pharmacy, admissions, and pediatrics. Also, the Infectious Disease Unit Cancer Association project, the kitchen and cafeteria. The container operating theater suites, post-anesthesia unit, and central sterilizing supplies department, which are being funded by Bill Health International and Direct Relief, are also expected to be completed at the end of this month. At PMH, some of the ongoing renovations are slated to be completed also at the end of this month. It is anticipated that inpatients' beds will be restored to address some of the patient capacity challenges at that facility. My fellow Bahamians, in-country testing is being augmented on an ongoing basis with the National Reference Lab, the Princess Margaret Hospital, and multiple private organizations now capable of COVID-19 tests. Grand Bahama Health Services, like the National Reference Lab and PMH, now has a gene expert machine to aid with surveillance testing. In Grand Bahama, we can report that they have begun processing samples as of today. The recently acquired automated RNA extractor at the National Reference Lab is now functional. With processing of 24 samples at a time, this allows lab personnel to direct their efforts, thereby decreasing time to results. As you know, timely receipt of COVID-19 test results greatly aid the staff of the Ministry of Health Surveillance Unit and volunteer contact tracers in carrying out their duties. As the contact tracing strike force continues to effectively manage COVID-19 data, the public is encouraged to please give accurate details, especially telephone numbers and addresses. First, to the doctor's office or lab taking the samples, and to the members of the contact tracing team. COVID-19 is with us, and unfortunately, that does not mean that all other illnesses and viruses have ceased. In a few short weeks, it will be October, which marks the beginning of the influenza or flu season. The flu season lasts until March. Last year in the Bahamas, our healthcare system treated thousands of people affected by flu or complications from flu. At this time, unlike COVID-19, there is a vaccine available to protect people from influenza. It is important that we all get the flu vaccine, especially during this time of COVID-19. The flu vaccine is safe and effective, and this is supported by years of research. Isolation of the first influenza H1N1 strain in 1933 and the first influenza B strain in 1940 led to the first bivalent flu vaccine in 1942. The flu vaccine has been around for 78 years. Currently, it is recommended that all persons older than 6 months should get the annual vaccine to prevent getting the flu unless specifically instructed not to by a doctor. The flu, similarly to COVID-19, is characterized by symptoms such as fever, cough, muscle aches, sore throat, and runny nose, and a general unwell feeling. Illnesses can be mild or severe. While it's important to get the flu vaccine each year because of new strains of the virus which circulate annually, this year, greater significance must be placed on availing oneself of the available flu vaccine. There is currently no vaccine for COVID-19. However, the flu vaccine can provide protection for us from the circulating current strains of the flu. Healthcare workers are encouraged to talk to their patients about the flu vaccine to educate them about the benefits. If you think you may have the flu, call your healthcare provider to get appropriate instructions on what you should do. Along the same path of vaccine-preventable diseases, according to the World Health Organization, immunization prevents 2 to 3 million deaths each year. Immunizations are important public health tools for the very young to older persons. For example, young children need their immunizations kept up to date to ensure that they are protected from preventable diseases such as mumps and measles. Parents have a great responsibility in this regard. Older persons should also get the pneumococcal vaccine to prevent pneumococcal disease such as pneumonia or meningitis. Getting immunized protects you, your family, and the community. Ladies and gentlemen, immunizations save lives. We know that adjusting to life with COVID-19 and health matters in general puts a toll on us all, including our healthcare workers. We value the personal sacrifice that our healthcare and frontline workers exhibit daily. We are grateful for the men and women who have worked extra shifts, volunteered, and even come out of retirement to once again serve their country. We are also grateful to their family members for sharing their loved ones' time and expertise with the nation. As we seek to ensure that our physical health is safe, let us also pay attention to our mental health. Watch for signs of depression, anxiety, stress, and insomnia. Now more than ever is when people need to talk to one another, check in, and assess emotions. The Mental Health and Psychosocial Services, the MHPSS helpline numbers are 819-7652, 816-3799, 815-5850, 812-0576, or 454-2993. Persons can WhatsApp or text those lines. At the Ministry of Health, we continue to learn more about COVID-19 as we traverse the waters of this continuously evolving virus. We intend to keep the public informed and updated every step of the way during and after this pandemic. Whether by press conferences, the dashboard, and press releases, presentations in the House of Assembly, webinars, television, radio, and online interviews, please be assured that the ministry will do its best to provide relevant information in a timely manner. Our team is comprised of a variety of persons with various skill sets who are constantly planning, collecting, and updating data, researching and utilizing best practices, working around the clock to ensure that we promote and communicate what is recommended for health, wellness, and the safety of our nation. We thank those members of the public who continually pray for us, send words of encouragement and support. We ask the public to continue to routinely follow the recommended preventative measures. Before you leave your house, ensure that you have a clean mask, your personal hand sanitizer, and any other protective equipment for your safety. If you see fellow brothers and sisters not wearing their mask properly, not using proper coughing and sneezing etiquette, touching their face, or being too physically close, respectfully intervene and help hold one another accountable. When you enter an establishment, two of the first things you should look for are the signs that promote the preventative measures, such as no mask, no entry, and a sanitizing station that you can utilize. If you do not see these, please speak with the business owner or manager and relay your safety concerns. Plan your outings and make lists to help you limit the amount of time or number of trips out into the general public. When you return home, engage in your sanitizing process at the door and ensure that you safely enter your home and interact with your family members. Health officials have intimated that this whole process will be with us for some time. But if we work together and follow the guidelines, we will successfully overcome this pandemic. Let us all do our part and stay safe. May the God of all comfort continue to bless and keep you. And may the Lord continue to bless and keep the Commonwealth of the Bahamas. I now welcome back our Chief Medical Officer.
Thank you, Minister. I will now seek to give a few further updates regarding our COVID-19 situation. First graph. Tracking the trends in cumulative or total cases is an important indicator for the course and impact of COVID-19 in the Bahamas. In the graph that you are looking at, the blue bars represent the total number of confirmed cases for the first wave. The orange bars represent the total number of confirmed cases thus far for this wave, which is the second wave. Thus far, during this wave, we have diagnosed 27 times the COVID-19 cases compared to the first wave. Specifically by island, for New Providence, which has the highest population density, we had 76 cases in the first wave. At this point in the second wave, COVID-19 cases now stand at 1,797, which is almost 24 times more than their total cases seen in the first wave. Grand Bahama recorded a total of 8 cases in the first wave. So far, for this wave, our second city has a total of 603 cases, which is 75 times more than their total cases in the first wave. Bimini had 4 times more total cases in the second wave compared to the first. The first wave, we confirmed cases only on 3 of our islands. On the contrary, during this wave, the COVID-19 has impacted a larger proportion of our family islands and keys, as referenced on the Ministry of Health's dashboard. Next slide. This graph shows incident or new cases, and cumulative or total cases for the second wave. The new cases recorded each day are in blue, and the cumulative cases are shown by the solid orange line that you see projecting upward. This line reminds us that we remain in the fight against COVID-19, and this is a graph that represents all Bahamas. What we must take away from this graph is that proven health measures and practices cannot be abandoned and selectively adhered to. The virus is circulating among us and will be with us for the foreseeable future. For these reasons, we continue to stress the need for individual and collective discipline. Next slide. As we move forward in today's press conference, we are going to look across a number of our islands. This graph that you're looking at now represents New Providence. New Providence now accounts for the largest number of new COVID-19 cases each day. The data show that cumulative cases continue to reflect increases in New Providence. Over the past week, however, incident or new cases in New Providence have been on a decline. On average, for the last week, 40 new cases are being reported in New Providence per day. Contact tracing efforts continue and is being supported by a team of 16 core public health surveillance officers, along with many volunteers and 87 reassigned public health nurses. In this second wave, almost 8,000 connections have been made with new cases and their contacts. The ministry continues to retool the process to ensure the shortest possible time between confirmation of a positive test result and notification of a newly diagnosed case. Next slide. Okay, this is a slide that I think many of you would be able to recognize. It's the island of New Providence. What you see on this slide in green are cases, and pink or fuchsia are contacts. We just wanted to give you an idea of how widely dispersed cases and contacts are on the island of New Providence. Next slide. This graph represents Grand Bahama. The COVID-19 picture for Grand Bahama is different. The public would recall that Grand Bahama had a 2-week lockdown, which commenced on the 23rd of July, 2020. Two incubation periods later, Grand Bahama has been experiencing decreasing numbers of new cases for the past 3 weeks and subsequent flattening of the curve. Next slide. This is Grand Bahama, and the green represents cases, and the fuchsia represents contacts. Next slide. Abaco. The picture is slightly different for Abaco, but Abaco's curve had begun to level off. However, we have seen a modest uptick in new cases seen over the last 72 hours, as you can see by the blue bar. And this warrants deeper exploration to understand what may be contributing to this and if it will be sustained. Nonetheless, we call for renewed community adherence to the public measures in Abaco and in all in all of our family of islands. Next slide. Now, I intentionally put this map of Abaco here. We have been consistently asked to provide a map showing the cases and the contacts on on our other family islands. In particular, I was asked for Abaco. Now, you don't see much green here. You see one or two fuchsia spots, in part because we have been challenged with getting the exact addresses for persons in Abaco, but we are continually working with BNGIS and with our public health persons on the ground in Abaco to be able to populate this graph for the persons in Abaco. Next slide. When we look at Bimini, the picture is encouraging. There is clear flattening of the curve. We encourage residents to continue to practice the measures so that we can have a sustained flattening of the curve on that particular island. Next slide. And we have here mostly our contacts. We also have a graph that we are working with BNGIS on to ensure that the cases and contacts are mapped. But this graph particularly shows the distribution of contacts on that particular island. Next. Here we have Eleuthera and Exuma. New COVID cases in Eleuthera remain in the single digits, with an average of less than 3 new cases in the period from the 8th of September to the 14th of September. We see this with cautious optimism. Exuma has reported no new cases over the past 11 days. And we remind the public that when traveling from hotspots, such as New Providence, to any other island, a negative COVID-19 test is needed. And immediately, quarantine for 14 days is required upon arrival at your destination. This is necessary to decrease the likelihood of getting increasing numbers of cases on any of our family islands, those that have experienced cases already and those who have not. Next slide. These graphs are just to show you that we are seeking to ensure that all of the islands that have cases, actually we're working with our partner to ensure that we are able to plot the cases and the contacts as best we can. Next. This graph represents all of our other family islands, and the numbers of cases we see on here is just to show that we have cases across many of our other islands. We did not go into the specifics of each island, but we have many additional islands affected, and we have to continue to do what is required to decrease the likelihood of increasing cases, and as best we can, stop transmission of COVID-19 on these islands. Next slide. When we look at the COVID-19 cases by age group and gender, what we see is that the cases range from newborn to age 99 years of age. It is important to understand this, and in order for us to be able to ensure that the necessary interventions are put in place. What we find, though, is that there is a concentration of about 41% of COVID-19 cases among persons ages 20 to 39. Another 37% of our cases are for the age group 40 to 59 years old. There is almost equal distribution, if you look at the graph, and you see the pink and the blue, there's almost equal distribution between the males and the females, within each of the 7 age groups displayed on the graph. We take note, however, of the 130 COVID-19 cases among children and adolescents, currently accounting for about 4% of our cases. Next slide. If we were to order our cases by age, from lowest to highest, the middle 50% of cases are between the ages 28 to 52, and that is what what is reflected on there as our interquartile range. For females, this middle is about 39 years of age, and for males, it is about 41 years of age. As said before, the second wave is impacting a younger population when compared to the first. With this information, we continue to target our messages to the public. We speak of, or we recommend, instead of face-to-face meetings, you may wish to try Zoom, or you may do FaceTime, or you may do WhatsApp with your friends and loved ones, instead of visiting their homes. And certainly attending parties or large group gatherings in the neighborhood or as a hangout is absolutely not recommended at this time. We recommend that you wear a mask that covers your nose and your mouth whenever you leave home, and certainly washing your hands, covering your cough and your sneeze is an ongoing recommendation. And a further recommendation is that you pretty much treat everyone as if they have COVID-19. That will help us to then practice the necessary measures to decrease the likelihood of spread from one person to another, and thereby break the transmission of our COVID-19 virus spread. As the minister alluded to, flu season officially begins in a few short weeks at the start of October. We can expect that the new reality of COVID-19 will only complicate the upcoming flu season, and it can overwhelm an already taxed health system and infrastructure. Our best safeguard is the flu vaccine. We send out a strong appeal to all persons 6 months and older to get their flu shot. Flu shots are available free of charge at all government clinics. In prior years, arrangements have also been made for our EPI, or our expanded program on immunization officers, to visit schools and businesses for greater accessibility to the vaccine. Next slide. So, when we look at our COVID-19 deaths, this slide speaks to our COVID-19 deaths by island as of September 11, 2020. The distribution of deaths across our archipelago, for the most part, follows our population density, with the vast majority, i.e. 69% of our COVID-19 deaths recorded in New Providence. A total of 65 persons have died, and 11 of these were in the first wave. Next slide. In this graph, we note the age and sex distribution of our COVID-19 deaths. In all age groups, more males, that's in the blue, are dying from COVID-19 than females. The exception is the 40 to 49 age group, where we see the pink bar much higher than the blue. Next slide. When we compare deaths across the first and second waves, which is on this graph, what we see is what is noticeable, most noticeable, is that 11% of our COVID-19 deaths in the second wave have been among persons under the age of 40, whereas in the first wave, we had no deaths in that age group. Next slide. This slide is just to show that we have had an increasing number of deaths due to COVID-19 in our second wave as compared to the first wave. Next. When we talk about our testing capacities, as it relates to what we are able to, who we are able to test, the green sections of the bar represents those COVID-19 negative tests, and the blue represents the positives. The largest number of COVID-19 tests were done in what we would refer to as Epi Week 36, or the week of the 31st of August. That same week, you would note that the lowest positivity rate was observed, and I think that's around 23%. Over the last 6 weeks, the average number of samples taken that have been reported as positive or detected is 25.1%, or 1 in every 4 samples are positive for COVID-19. Next slide. During the first wave, we're still talking about testing. And what this slide shows is that during the first wave, our National Reference Lab was designated, which is designated on this graph as our NRL, carried the full weight of our COVID-19 testing in country. Shortly after the start, however, of the second wave, we had Doctors Hospital Lab as well as the Princess Margaret Hospital Lab come on stream, which has enhanced the capacity for us to carry out the COVID-19 testing in country. This slide in particular shows the breakdown of the samples processed by each lab. The maximum COVID-19 testing capacity of Doctors Hospital Lab is approximately 288 samples per day. PMH Lab is about 70 to 100 samples per day, while the National Reference Lab is about 150 to 180 samples per day. What we are happy to announce is that the capacity on Grand Bahama to do their own testing will likely be either on stream already or it will be on stream very shortly. And their daily capacity for testing will be another 40 samples. We also know that there are a number of smaller labs that we get reports from into our national count for COVID-19, and they also assist with COVID-19 capacity testing in country. We encourage all labs and all healthcare professionals who are actually managing COVID-19 tests, COVID-19 suspects, or diagnosing cases to ensure that those cases are reported to the National Disease Surveillance Unit to ensure that the necessary contact tracing is started in order for us to break the transmission of COVID-19 in our country. I thank you. So we will now move on to answer questions from our reporters. Altaviz Munnings, ZNS.
Good afternoon, ma'am. How you doing?
I'm good.
Back in July, an international report had suggested that COVID-19 mutation makes it 3 to 9 times more infectious. Would health officials attribute this to the rising cases here in the Providence, or just that residents here in the Providence are not following health safety protocols?
Okay, I know we have Dr. Forbes on the line, but I would allow her to answer that question. Is she?
Good afternoon. Thank you very much for the question. Yes, there have been some information, some newer information that there are various strains of COVID-19, and it's postulated that some may be more infectious, but have a lower mortality rate. However, it's not confirmed, and worldwide, in the usual day-to-day management of such cases, there is no information on strains of COVID-19. We certainly don't have information on the SARS-CoV-2 virus and strains in country. We do know that a number of persons are still mixing. Sick people are mixing with well people, and there's ongoing transmission of the virus. It can't be attributed to a more infectious strain.
Thank you, Dr. Forbes. Second question.
Thank you very much. My second question is, are health officials, or do health officials have a plan in place now for whenever a vaccine is available for COVID-19? Is health officials researching a certain vaccine to help Bahamians or to help fight the COVID-19 pandemic here?
Certainly, I would begin to answer that question, and maybe my minister would wish to add some more. We have started looking at a number of avenues in order to be able to access the vaccine. Certainly, we started to work with the Pan American Health Organization, who is a partner with us in the Bahamas for many, many years. I'll let the minister give you a little more information regarding our progress in that vein.
Thank you, CMO. As the CMO said, the Pan American Health Organization is going to secure any potential COVID vaccine for the Bahamas. The WHO has required that all countries that would be seeking the COVID-19 vaccine, one that has the capacity to be able to do what we expect it to, that every country put a down payment, so to speak, to ensure at least 20% of its population. The Cabinet of the Bahamas has taken the decision to move forward with that. We do secure our vaccines through the WHO via PAHO, and we're guaranteed to receive enough vaccine in the first tranche to vaccinate 20% of our population, which, if you're looking at 400,000 persons, is about 80,000 individuals. The overall cost is going to be somewhere in the area of perhaps $2 million initially. And at the outset, what we will do is we will seek to vaccinate those who are most vulnerable, healthcare workers, along those lines. But because there's such a demand for a potential COVID vaccine, and you understand that first world countries, because their monies are long and deep, have the capacity to be able to purchase upfront more so. But the World Health Organization is securing and ensuring that all countries have an opportunity to receive the vaccine. And there's a global agreement among all countries that we will receive at least 20% initially to secure our populations.
Matthew Moxie.
Hi, yes, good afternoon.
Good afternoon.
Yeah, so as we see an ever-increasing case count here on Providence, there is a need not only to keep the citizenry safe, but also our leaders that we are relying on to guide us through this pandemic. So my first question would be, are there currently any cabinet ministers that have tested positive for COVID-19 or is currently in isolation with the virus or suspected to have the virus?
I'm looking at my minister and he's giving me a no. I am not aware of any, so that would be a no, not to my knowledge. Number two.
Thank you. And also, There have been some concern from persons and patients about a testing facility that sometime last week, some samples were allegedly contaminated and that testing was halted and they were being redirected to another health facility to take their test. Has the Ministry of Health received any reports of any testing labs or facilities having to shut down or anything of that nature? And if so, can you please explain the situation? Also, I note that the CMO sent a message in her closing to labs about reporting cases and things of that sort. Did you also have an issue with private labs and testing facilities and their reporting and management of patients? And please forgive the loaded questions, but I know this is the first presser we've had since August 28th, so a lot of things have happened since then, so I would be grateful if you can address all parts of my question.
Okay. So, as it relates to reports of a particular lab that would have shut down and had to shift samples, certainly, to my knowledge, none of the major labs that we are using, as I would have referenced in my presentation, i.e. Doctors Hospital, PMH, or the National Reference Lab, to my knowledge, had no difficulty with testing over the last week. As it relates to your other question, as with reporting and notification, early in the COVID-19 outbreak experience, we would have sent communications out advising that COVID-19 is a reportable disease, and as such, if it is diagnosed by a lab or a healthcare provider, there is a responsibility for reporting to the National Disease Surveillance Unit in order to ensure that the necessary public health measures are taken. Now, you know, I just like to ensure that we repeat that every time. To my knowledge, you know, we are getting reports from those labs that are coming on stream. And certainly if there are labs who are out there who are not reporting to the National Disease Surveillance Unit or healthcare providers, we continue to encourage you to do so, as the public health measures must be put in place, i.e. isolation, quarantine, to ensure that we, you know, decrease the likelihood of others becoming infected. I do not recall the other parts of your question, but I think I would have answered the major parts. Kyle, walk in.
Hi, the first question is for the minister, actually. Minister Wells, you would have mentioned that the morgue at PMH is packed, or families aren't collecting the remains of their loved ones. Can you say how many bodies we're talking about? What are the storage fees? And if they don't pay these fees, what is government going to do legally? You know, I mean, can you necessarily kick the dead out of the morgue?
Kyle, we do have the officials from PHA here, and I'm going to punt that question to the officials from PHA as to the numbers of persons, if they have an idea as to the numbers of bodies in the morgue. But I also wanted to say, while they come, that you asked the questions about cabinet ministers testing positive for COVID. There are no cabinet ministers, as was said by the CMO, who's tested positive for COVID. We have had a number of cabinet ministers who have had to quarantine. As you rightfully know, the Prime Minister quarantined for 14 days, the Minister of Education, the Honorable Jeff Lloyd, quarantined for 14 days. You had the Attorney General who had to quarantine for 14 days. And there's another one of my colleagues, the Deputy Prime Minister, who went through actually 2 sets of 14-day quarantine periods. We do have a number of members of Parliament who have tested positive for COVID. As you would know, the Member of Parliament for South Eleuthera, Hank Johnson, had tested positive for COVID and was treated and released. We know that the Leader of the Opposition had tested positive for COVID and was treated at PMH inside the country and outside of the country. And we do know that the Shadow Minister for Health on the opposition side, Dr. Davel, had tested positive for COVID. But to date, no cabinet minister has tested positive for COVID. And so now I'd have PHA. Thank you.
My name is Catherine Reich. I'm the Managing Director of the PHA. With regards to your question about the morgue and the morgue capacity at Princess Margaret Hospital, I can say to you that today we are are over capacity by about 4 times. We have a capacity in our main in hospital for 55 bodies, but to date I think we're running 4 times that amount. I should also mention that at the Grand Bahama Health Services, likewise, we have a capacity of about 25, and at times our numbers can go up 2 to 3 times that amount. Since the start of COVID-19, we instituted policies to ensure that patients dying from COVID were separated from the main population. And those bodies were accommodated in the external coolers of the hospital. To date, we recognize that as over time, the morgue, as indicated by the minister, has been used by the general population, as a storage facility until such time as bodies are ready for burial. To date, and with COVID-19, we want to continue to impress upon the general public to ensure that they work with us to ensure that those bodies are removed in a timely manner, thus allowing us the opportunity to be able to properly manage those bodies that we have to hold, requiring any examinations. But certainly to ensure that we create environments where we can safely take care of our bodies, the remains of your loved ones. So we want to impress upon the public to please work with us. We have our facilities open Monday through Friday, and by all means, the Medical Records Department facilitate all discharge of bodies from the hospital. Thank you.
Your second question, please.
Yes, my second question, during the last press conference, we were told that Cabinet had approved the hiring of around 30 junior doctors. Any update? And also, I understand many of them have still not heard anything, that's why I asked. And where do we stand with the backlog in testing? If you can clear that up for me as well.
Which question would you wish for us to answer?
Well, both really, but I guess take the first one regarding the doctors.
Okay, we have Dr. Caroline Burnett here, our minister.
Thank you, Kyle. The Cabinet of the Bahamas did take the decision to hire the 29 SHOs, and the only thing that is required now is the conclusion on the matter. But the Cabinet has agreed to hire those individuals, and I think they will be hearing from PHA and the Ministry of Health. The Ministry of Health very, very soon. As some of them, I believe, are already in the system. Well, all of them are already in the system, but they will be hearing from us very soon. The Prime Minister made the commitment to hire them, and we've hired them.
Thank you, Minister. Elizabeth Bryan.
Good day, Dr. McMillan. Good afternoon, Bahamas. Elizabeth Bryan with the Lutheran newspaper. Our first question is, there are a significant number of cases reported on the Ministry of Health's daily dashboard with locations pending. What piece of data is missing that would allow a case to be assigned to a particular location? Is it where the person lives, where the person is infected, where they intend to reside after the test, like during quarantine? What is the missing piece of data that allows a case to come off of that list?
Exactly which island they are resident on. There are a number of challenges we've had with the completeness or lack thereof of our, case investigation forms. And we continue to request that our healthcare providers actually provide as much information, they capture as much information regarding persons when they are actually, in their presence and the swab is being taken. We have moved to a platform that is to assist us with that, an electronic platform, SharePoint, and we are hoping that moving forward, I think we're already seeing a little more, well, some benefit from having the data capture at the point of care. But the piece of information required is exactly which island the person is living on. Next question.
Dr. McMillan. All right, second question is, Eleuthero's case count has doubled within the past 2 weeks, moving from 6 to 12 cases. Can you clarify for the Eleuthero public whether these cases are a growing cluster, for example, in central Eleuthera, or are they more widespread throughout the islands? Simply put, what is the current distribution or locations of COVID cases throughout the islands of the Eleutheras? And is it possible to report the number of currently active cases per island alongside their total cases on the dashboard?
I would start with your second question, and then I'll allow Dr. Bartlett, who I believe is on the Zoom, to speak to the picture for Eleuthera. Certainly, the dashboard is pretty small, and it gets crowded quickly. We recognize that our situation is such that we have many islands, and I believe you may recall early on we started putting more detail for each island, but as we got more and more islands having cases, it became very difficult and pretty much running out of space. I think certainly we can seek to provide that information to the public, maybe through a different means, a different mechanism. But yeah, pretty much I think the dashboard may not be the best place for that, but we will take it into consideration and look at how we could begin to provide that next level of detail to the public. Dr. Bartlett?
Yes, good afternoon, Bahamas, and thank you so much, Ms. Bryan, for your question. So I'll do the breakdown as it pertains to Eleuthera. In the north, that is Harbor Island, Spanish Wells, and the mainland, which encompasses the Bluff and Upper and Lower Morgue. I'll start with Harbor Island. So Harbor Island has no reported cases of COVID today. Spanish Wells today have 1 reported case, and that case has since been recovered. And I will then move to mainland. To date, mainland has no reported cases of COVID. So I'll move now to the central and south Eleuthera. Central has 8 reported cases of COVID. And south, where we have seen our increase in cases mainly over the past week, have now 3 cases. So you would have remembered that we had 8 cases initially for Eleuthera. We're now up to 12, but those 4 additional cases being 1 central and the other 3 now in south. So we do think that there appears to be a cluster in South Eleuthera, and we are thinking it may be in the Wims's Bight area. Good afternoon, and thank you so much for your question.
Thank you, Dr. Bartlett. Krishina, Virgil.
Good afternoon.
Good afternoon.
Krishna Virgil Russell, the Tribune News Network.
Krishna.
My first question is, there were more than 400 new cases of COVID-19 in the past week. We've heard health officials praise the GB lockdown, and the Prime Minister has said there will be no more complete lockdowns, but perhaps a partial one. But should we have opened essentially everything with steady cases coming in every day, especially in New Providence with around 40 cases a day?
So, whether or not we opened everything or just a few things, certainly what we require to happen as we move forward is that we follow the necessary public health measures in order to decrease the likelihood of spread. I think, we often say when we are asked a question like that public health must always take into consideration other things that are happening in a particular environment, and there has to be a balance. We would have had a number of lockdowns. We had curfews. We had, a number of very restrictive to minimally restrictive measures put in place early on, and we did fairly well. Doing those things indefinitely is not sustainable. So we have to balance the public health measures alongside the economic and the social measures that, and the social challenges that come along with the lockdowns. I don't know if Minister wished to add anything to that. If not, next question.
Okay, my next question is going back to the hiring of those doctors. So on top of them, I've already heard the minister respond about they'll be hearing from officials soon about their job statuses. But we're also told a couple weeks ago that 3 of those doctors had failed. But recently, in the past 4 days, I was made to understand that actually 2 of them were pregnant and had some challenges in completing the needed, I guess, the things that they needed to complete in order to finish the program. The concern among the general body is that these 3 people or these 2 people will be passed over for a job opportunity. Can the minister or PHA officials specifically address that concern?
Sure, Dr. Burnett.
Good afternoon. So the internship program, which is held at the Princess Margaret Hospital, is the University of the West Indies. We collaborate with them, and there are certain requirements that are in place to complete internship. And so, of course, you have to pass the end of clerkship exams, you have to perform on the wards adequately, see a certain number of patients, do a certain number of procedures. And the interns are allowed 1 week of vacation per 3-month rotation. If they miss more than 2 weeks of a rotation for any reason, illness, pregnancy, then the rotation either has to be completed in total or the time has to be made up. And we have 1 intake of new SHOs per year. So every July, usually, new SHOs are hired when the internship is completed. So those 3 persons will certainly be invited to apply for a post next July.
Rachel Knowles.
Good afternoon. My question is for Minister Wells. A few times, the minister said that, at least twice, once in the last press conference, the minister said that I believe 18 beds at Super Clubs Breezes were available for COVID-19 patients. Obviously, last week, the Prime Minister said that is not the case, and he called those reports fake news. My question is, I've been told that that's a matter of semantics. Is it the case that suspected COVID-19 cases are being kept or have been kept at Breezes?
I'm going to let the folks from PHA speak to it, but the Ministry of Health did put out a press release as to the position of Breezes, and interestingly enough, the news report that most folks are referring to, the paper came out on Thursday morning, but it was 24 hours before that, on Wednesday, in the House of Assembly, around 11 o'clock in the day, the Prime Minister and I said the exact same thing about what was taking place at Breezes, but that was not what was reported the next day in the papers. But we do have the officials here from PHA, so I'll let them speak to Breezes.
Good afternoon again. So the Breezes facility, the National Response Center, was opened because we had a need for management of PUIs, persons under investigation. At the time that came on stream, the hospital was overwhelmed, the whole healthcare system, with PUIs. And so we had 18 beds placed there, along with adequate staff for mild to moderate PUIs to be managed there, with the understanding that if we got back a positive test, those persons would immediately, or once the facility was available, be moved from Breezes, either to Doctors Hospital West, back to Princess Margaret Hospital, or to the South Beach Clinic. At this time, because our labs are so efficient, the results are coming back very quickly, and as you know, there's a surge, so we have a lot more positive cases. So positive cases were not kept at the Breezes Hotel, but however, we did have persons that, when we found out they were positive, they were moved as soon as we could get them out of there.
Next question, please.
Okay, so moving on, I know that the Prime Minister said that lockdowns will not be considered going forward, but he did mention that the government would, or that he would consider locking down parts of New Providence in the event that there's an outbreak there. But as we saw on the map that was presented today, there seem to be COVID cases across the island. So is that still something that's being considered, given that it doesn't seem that any particular part of New Providence can be locked down and not the rest?
Certainly, COVID cases across the island is pretty much where we are. However, as we monitor the new cases and their location, where they are, if there's a particular surge in a particular side of the island or among a particular community, of course consideration can be given to lockdown of that particular area. It's not an easy thing to do, but certainly I know of a number of countries in the region, in the CARICOM region, who would have done it, and they had some success with it. But we will continue to monitor the cases and where they are happening and make recommendations along the lines of, public health measures, be they very restrictive or, lesser measures. But I think that the public needs to begin to get in the mode of, COVID-19 being with us and starting to begin to do things that not necessarily the gatherings and those types of things that that are known to cause increases in cases, but continue to do the public health measures like ensuring that you wear your mask, ensuring that you physically distance yourself, avoid the gatherings, and so we can exist with COVID-19 as best we can, and avoid having to move to the point of a partial or, well, the PM said we won't have full lockdown, so let us continue to do what is required to keep each other safe as we exist with COVID-19, which is going to be with us for a while. Karen Bain.
Hi, good afternoon. Karen Ferguson Bain, Global 99.5 FM. There are reports reaching our radio station that the operating theater at the Rand Memorial Hospital was compromised. Can the Ministry of Health speak to that, and if there are any healthcare workers who are infected?
We have Grand Bahama on. I think we have Grand Bahama on. Okay.
Okay.
Dr. Lockhart.
Thank you for the question. This is Dr. Freeman Lockhart from Grand Bahama. And with regards to the comment that the operating theater at the Rand Memorial Hospital being compromised, I am certainly unaware of that. I don't know if reference is being made to the damage sustained to the operating facility during the passage of Hurricane Dorian. If that is the case, then the operating theater are still being repaired as it relates to any damages sustained as a result of the passage of Hurricane Dorian. But certainly, as of late or recently, I am unaware of any damage sustained to the operating facility at Durand Memorial Hospital. Thank you.
Thank you, Dr. Lockwood. Your second question, please.
Thank you very much. My second question, what are the recommended protocols by the Ministry of Health for asthmatic students as they return to the classrooms?
We have Dr. Swan here with us. He's working very closely with the Ministry of Education on the return to school policies.
Good afternoon. Can you just repeat your question one more time for me?
Yes, sir. My question is, what are the protocols recommended by the Ministry of Health for students who are asthmatic as they return to the classroom setting?
So there are no specific requirements or guidances for persons with asthma who return into the classroom setting. The reality is that persons or education has been advised as to the necessary precautions in keeping the school environment safe and making sure that persons are physically distancing, practicing infection prevention control measures to ensure that they are, if they are positive or in contact with someone who is positive with COVID-19, that they don't transmit it to another individual. But specifically for children who are asthmatic, there's no new guidances, the same guidances that they would have been given from their primary care providers prior to COVID-19 will exist, and which is basically ensuring that their triggers are avoided and that specific attention and care is paid to maintenance to prevent any flare-up of their asthma conditions. Thank you.
Royston Jones.
Good afternoon.
Good afternoon.
Just want to ask, there has been an incremental increase to over 15,000 tests, as we see on the dashboard, but we continue to ask every few weeks how many people have been tested. As we know, a suspected case or confirmed case can receive multiple tests upon presenting and after the period of being symptomatic. And we know that, as health officials have said, there's a direct link to testing and the discovery of cases. So again, can we get an understanding of just how many people have been tested, even if it's an approximate? We still don't know of that 15,000.
Certainly, to my recollection, that question was actually asked earlier today when we were in another setting. And to my recollection, I think we have about 14, is it 14? 14,000 individual tests that would have been done around that ballpark. Sorry, Dr. Swan? Persons, right, individual persons tested.
Approximately 14,000 people, okay.
People, yes. Okay, thank you.
My second question, if I can then, is have there been on record any imported cases in the Bahamas to date?
That's a good one. Certainly early on, I think we had one that we had considered imported. But beyond that, most of our cases, they may have been import related, but not necessarily imported. So the cases that we are having based on our travel history requirement or our ask of our persons, they are local cases. Tyler Simonet.
Yes, good afternoon to the Ministry of Health team and good afternoon to the Bahamas. My first question is about the COVID-19 dashboard. The cases under locations pending have been above 100 for about over a week now. Can the health team explain under what circumstances would a positive case be put under location pending and what requirements need to be met for the case to be put under a certain island's count?
So I guess I would seek to elaborate a bit more on what we have. Case investigation forms that or certainly it was paper-based initially, where we ask for all of our healthcare providers to gather certain information from anybody who they are taking a sample from to be tested. Included in that is the island of residence. And so if that data is not, or that particular field is not completed during the data capture, while you are actually there with the patient, it makes it a little more difficult for us to be able to track down, where this person actually lived. So we have now moved to an electronic platform, and I'll ask Dr. Swan to give us a little bit more about the SharePoint platform that will help us to gather the information a little easier so that we'll have decreasing amounts of those data gaps.
Good afternoon again. Yes, so as the CMO has mentioned, the challenge that we are facing and trying to address is getting the forms completed accurately and completely by clinicians who are requesting tests, as well as by lab centers who are performing tests. And once that information is provided, we're able to identify a number of key components of the individuals who have been tested, mainly their sex, their age, as well as where they are located, when they were tested, or where they originate from. And in addition to that, there's symptomatology. So these are specific areas of the form that we require and request to be completed on any individual who is tested for COVID-19. You would have realized that this has arisen as part of the second wave because we have more centers who are offering testing and not as, I guess, judicious in making sure that those areas are completed. We have entered into the national testing facilities a requirement that unless these form fields are completed, the tests will not be ran. And the other component as well is that the SharePoint system, as I was asked to speak about specifically, is one where we're requesting the online completion of this data prior to the test being taken to decrease the likelihood of this information being lost in transition, as well as to increase the efficiency in which we can report on the findings when someone tests positive. So location pending really means that information on that individual was not readily available on the form when the result was received, as well as the individual may have provided the incorrect contact information for us to contact that individual to verify their location. So a number of factors go into us listing that position as location pending, and that simply means that at the case and time of us reporting on this individual, we do not and cannot verify the location of the individual who was tested positive. Thank you.
Second question, please.
Yes, thank you so much for that response. Minister Wells last week spoke about the claims on social media about the mothers who say that they received inadequate care at Princess Margaret Hospital, and as a result, some of them lost their lives or lost the lives of their children. It was stated that the Public Health Authority was looking into the matter. Can we get an update on that from the PHA?
The Managing Director, Weish, will speak.
Good afternoon again, and thank you for that question. The Public Hospitals Authority is at present investigating a number of claims made by patients who receive care at our various facilities. We take all of these claims very seriously, and everyone is being investigated on its own merit. We have a process and we have a department specifically established for managing all of our risk-related incidents that occur within our hospitals. And they are in the process right now of investigating the complaints, gathering the respective data, interviewing the respective individuals, And I'm sure you will appreciate that while these investigations are ongoing, we have an obligation to ensure a level of confidentiality. At the completion of our investigations, we will provide for the persons making those complaints interviews and our findings, and be assured that we will take every measure to safeguard our patients as well as protect the interests of our employees. COVID-19 has been a particularly difficult time for all of us, and I would just like to send a shout out to our healthcare providers that while we in the PHA are seeing an increased number of complaints coming at us, be assured that we are working tirelessly to ensure that we provide care to every single patient that walks through our doors. And so I want to reassure the public that while we hear claims of not wanting to come to us, this is difficult, but we are doing our best, and we will take every claim made against us very seriously and investigate each claim on its merit. And at the end of the day, we'll do our due diligence in ensuring that we report back to those individuals that makes the complaints. So thank you very much. Thank you.
So that will conclude today's press conference. Thank you very much for joining us, and have a wonderful evening.